So for an infant consultation, what we'll do is, of course, get to know the family and understand their feeding goals. And then we'll do an oral assessment. And then once I've seen the anatomy, I already have the information from your functional provider, which is how you got an appointment to see me. You've already seen either a lactation consultant or a speech therapist who's helping you with your feeding journey. So combining that functional information with the structural exam, looking at the anatomy, is how we kind of determine what next steps should be and if a release would be appropriate for your family. I allow 1 hour for the appointment for patients who already have seen a lactation consultant or functional provider, and that involves the consultation and going through questions, as well as the procedure and feeding afterwards. So before an appointment, we will send you an intake form. And that form is going to go through your feeding journey, your goals, and what's going on with the feeding process and what you're working with your provider with. Once we have that information, then we'll go ahead and schedule your consultation appointment so that we can get more information about your family. So when we're screening, I'm just making sure that I'm looking at doing an oral exam under magnification with good lighting. During the procedure, we would use a CO2 laser. We choose that tool because it offers precision and to have a good visual field where I'm working. It also helps improved healing, and it also gives the option for bleeding control during the procedure. So we can go into a procedure confidently knowing that we have the best tool available. For infants, if we have addressed the functional issues, tethered oral tissues, and we still have goals, sometimes we will involve an ear, nose, and throat doctor to determine if there's anything that we can do to help with nasal breathing. We want families to be empowered to help their children get to a good start. So for patients who are already seeing one of our trusted referral sources, who's familiar with our work, and we come in prepared, knowing about the stretching protocols and having identified our functional need and having lined up all of our post-op appointments with our other providers, those patients often are seeking same-day treatment. And that's typically what we'll do, is a release the same day with all that proper preparation in advance. For patients who are earlier in the process and are still establishing their team, we can be the first stop and take a look and kind of help patients learn about the process and where to go next, and then come back a second visit for a procedure if it's needed. But it's important that we see these functional providers because there may not be a need for a release. It's important that we're identifying issues with latch, any kind of positioning help that may be needed. And this is true for families that are breast or bottle feeding. We want to make sure that we're identifying any kind of functional concerns first before we discuss any kind of procedure.